On December 7th, I wake up that morning. I mean, it was, a normal day other than the fact that I had to take an exam, which means that normally I would have been at work or driving to work.
He woke up, wasn't feeling the greatest, but again, he had had like a cold beforehand, so we just felt, we figured it was just like the nerve issue and maybe he was coming down with the flu.
I remember looking at a phone or something. I remember 7:34 in the morning.
And then all of a sudden he went into kind of a seizure for a couple seconds and then just completely unconscious.
My shift was coming to an end and I was about to be relieved, and we were toned out for a difficulty breathing call.
I had CPR training about 20 years before. I didn't remember a whole lot of it, but I started trying to give him some breaths, and the 911 operator told me to just don't worry about that at all, just start chest compressions.
Every minute that goes by, a patient loses approximately 10% chance of their survival. So if a patient goes into cardiac arrest and nobody's there to do immediate CPR, essentially that patient can lose up to 60 or 70% chance of survival before EMS arrives.
The importance of keeping Dustin's brain alive with the oxygen that was already in his blood at the time was the most important thing that we could do for him.
The EMS had transmitted his EKGs to the emergency department prior to arriving into the ER, so we knew what we were waiting for and what to expect.
Not only were we able to get a heartbeat, but the most important thing with the heartbeat is to actually have identifiable brain function. He was not just having his heart beating, but his brain was working.
Knowing before we left the hospital that he had a really good prognosis of survival and neurologically intact survival was extremely rewarding.
With my first EKG, the electronic heart check showing what's called an ST segment elevation MI, otherwise known as a heart attack, and we got him over to the cardiac catheterization lab where they were able to open the heart artery, which was apparently the cause of this to begin with.
This is where his heart attack occurred. This should be open with a dark band going all the way down, but as you can see, it's occluded 100% right there. And these are final images after the stent's been deployed and we cleaned up other parts of the artery to show adequate blood flow going all the way down to the end of the vessel. And this is final image showing his heart muscle had not taken any major damage with good normal preserved heart function.
We've talked to people that have gone through the same thing Dustin has, and a lot of the outcomes are just not good.
So in cardiac arrest, the chain of survival is incredibly important, and it starts with the bystander. As soon as somebody goes into cardiac arrest, it's incredibly important that the bystanders start CPR.
So the most important thing there was his wife was able to call 911 when his pulse stopped, started chest compressions. 911 had good response time, arrived, started the initial treatment with the second most important thing, the first shock delivered, and get them to us in a timely fashion to give us a chance of saving his life.
I'm living proof that good resuscitation methods, improves the 6% outcome that, statistics show today.
One of the greatest gifts that we could have been given was to know that Dustin was able to go home to his young family and spend Christmas with his family. And just to be a small part of that process was an absolute blessing.